And I want to subscribe to the views of my colleague from North Dakota on the importance of developing our great resource of natural gas, turning it into liquefied form, and solving a lot of the problems that we face around the world. I also want to commend Senator Hoeven and Senator Wyden for the exchange which they had briefly a few moments ago on a bipartisan approach to funding our infrastructure problems and in the immediate and the long range sense. And I would note, as I move to talk about Obamacare, the absence of any such bipartisan accord during 2009 when the Affordable Care Act was being debated by the Senate. Thus, we have what in April 2003, Senate Finance Chairman Baucus called a huge train wreck. He was right in seeing the train wreck coming on the rollout and the website, but it also has turned out to be a train wreck in far more than the website glitches and the enrollment fiasco. The train wreck of the Affordable Health Care Act continues in the way the law is affecting health care coverage and the way it's affecting the pocketbooks of American families. These families were flatly told that their health care premiums would go down. They were not told their health care premiums would moderate. They were told that their health care premiums would go down. Instead, we have all of the problems that we're facing with regard to Obamacare in the way it affects women, in the way it affects wage earners, in the way it affects people who are looking for full-time employment. And frankly, the Obamacare law continues to drag down our economy and our chances for economic growth. Instead of seeing premiums drop by $2,500 on average each year, as President Obama promised, families and individuals are spending more of their hard-earned dollars on health care costs under this so-called Affordable Care Act. The sticker shock will only worsen, and it's going to happen right around the corner. In recent weeks, several states have announced preliminary estimates for next year's premiums. The Wall Street Journal reports that many of these states, the largest health insurance plans, plan to increase premiums by between 8.5% and 22.8%. These are annual increases coming up right around the corner of either 8.5% up to 22.8%. For many Americans, this means either paying a lot more or simply not being able to have coverage at all. The administration is trying to downplay the cost, but it is clear that once again, Obamacare is failing to live up to its billing. Some states are particularly vulnerable to higher rates next year because of low enrollment among young adults, or because few insurers have joined the exchanges. For example, in my home state of Mississippi, 94% of enrollees are eligible for federal subsidies, which means we have little competition to drive down rates. According to this year's numbers, my home state of Mississippi already has the third highest premiums in the nation, and we can't afford them. Competition cannot flourish when the government is involved in setting mandates for benefits and controlling rates. Without a market-based approach, which I advocated in 2009, consumers lose out on choice and cost. Particularly hard hit by the President's health care law are women and younger wage earners. With regard to women, for example, women are more likely to pay higher out-of-pocket costs under Obamacare with plans with high deductibles because they typically visit the doctor more. As 57% of the part-time workforce, women are also more likely to have their hours cut because of the employer mandate. And I note, Mr. President, that the employer mandate is increasingly unpopular among Democrats and Republicans. Additionally, the law's limited physician networks have forced many women to choose different specialists for themselves and their children, thus making it less convenient for these women to get care for themselves and their children. Stories from women across the country underscore these difficult realities. Last year, a woman from Columbus, Mississippi wrote to tell me that her original health care plan was $500 per month before it jumped to $1,500 a month because of the ACA. One woman from North Carolina gave this reaction to unaffordable premiums. She said, "I've never worked this hard in my life, but I'm going to continue working every day to keep hitting the books at night. I'm just trying to keep my head above water." Another woman from Texas who could not find an obstetrician that would accept her insurance said this, "It was mind-numbing because I was just sitting there thinking, I'm paying close to $400 a month for me to have insurance that doesn't work. So what am I paying for?" Women make approximately 80% of healthcare decisions in America. More choices and lower costs would give them the flexibility they need to get the right insurance plan. Now, with regard to younger workers, Mr. President, they are generally healthier but earn less, and they're faced with daunting realities because of the health care law. Specifically, younger workers are forced to pay higher premiums to subsidize coverage for older Americans. I was contacted by a constituent from Greenville, Mississippi, whose healthy 27-year-old son lost his health insurance because of Obamacare. The cost of his coverage went from $70 per month to nearly $350 per month, even though the benefits improved only slightly. Although this young man had health insurance for 7 years, since he was 20 years of age, he's now questioning whether he can afford it. And finally, Mr. President, all Americans are affected by a health care law that destroys jobs. Now, last month, the economy added 288,000 jobs, but only a fraction of them were full-time, as we know. The Obama economy is a part-time economy. Millions of Americans want full-time work. The president's health care law was pushed through with no bipartisan input and in defiance of public opinion. After the Massachusetts special election, this Senate should have gotten the message that we needed to regroup and rethink this disastrous law. But the majority party pushed forward regardless. And it's no surprise that the law remains deeply unpopular today. According to a recent poll, 55% of Americans wish it had never passed. And 44% said America is now worse off because of the ACA. In summary, Mr. President, under the Affordable Health Care Act, women are worse off, younger workers are worse off, people seeking full-time jobs are worse off. Elections have consequences, and November will be no different. The American people have an opportunity to change the course of this disastrous law in 106 days.